Welcome all. Today we are going to see a topic in surgery, that is dermoid cyst, and it is a topic in the chapter swellings. It is an important 5-mark questions for university exams. So coming to the topic, what is dermoid cyst? So this cyst, consider this is a cyst and it is lined by a cell called as squamous epithelium, and the contents is T squamated cells. The sebaceous cyst, which we learned earlier, is also lined by squamous epithelium only. And coming to the contents are putty in consistency in the sense toothpaste like consistency, and it contains mixture of sweat, sebum, desquamated epithelial cells, and sometimes hair also. So name itself indicates it is a dermoid cyst. There is a word dermis here. So what are all the contents of dermis is sweat glands, sebaceous glands, and also hair follicles. So the secretions of sweat glands is present here, sweat, sebaceous gland is sebum, and hair follicles is also present. So it contains sweat, sebum, desquamated epithelial cells, and sometimes hair. So this is the definition of dermoid cyst and its contents and the consistency of the contents. So next, after writing all these things, we are going for types. There are 4 types of dermoid cyst. That's first one is sequestration, tubular dermoid, implantation dermoid, teratomatous dermoid. So these 3, sequestration dermoid, tubular dermoid, and teratomatous dermoid, is congenital, and this third one, implantation dermoid, is an acquired one. We'll get to know why it is an acquired one as the video goes on. So next, coming to the first type of dermoid cyst, the first one is sequestration dermoid. As I've said earlier, it is a congenital type of dermoid. So for understanding what is sequestration dermoid, let's imagine a hypothetical situation that consider there is an earthquake happening. This is a land, and this land cracks into 2, and the contents over the surface, that is stones, grasses, falls into this crack, and later on this crack closes. The contents gets sequestrated here. This content gets compressed here, sequestrated here, and it turns into a mass. So the same thing happens in the sequestration dermoid also. So this sequestration dermoid occurs at the line of embryonic fusion. At the line of embryonic fusion, few epithelial cells gets buried like this. And get sequestrated and forms a cystic swelling beneath the surface. So this is known as sequestration dermoid. So let's see the definition. Occurs at the line of embryonic fusion. So due to the inclusion of epithelium beneath the surface, which later gets sequestrated, forming a cystic swellings in the deeper plane, always found in the midline. So this is nothing but it is found in the line of embryonic fusion due to the inclusion of epithelium, which later the included epithelium gets sequestrated and it forms cystic swelling in the deeper plane beneath the surface. So this is the definition of sequestration dermoid, and there are there are some examples of sequestration dermoids. That is, it may occur anywhere in the midline of the body. The few common examples are external angular dermoid cyst, internal angular dermoid cyst, median nasal dermoid cyst, preauricular dermoid cyst, postauricular, sublingual, and in suprasternal space of burns. So the complications are infection, suppuration, and ovarian dermoid. And clinical features. Next is clinical features. As we've seen already in sebaceous cyst, the same thing, painless swelling, smooth, soft one, and it common age group is 20 to 30 years, and Paget's test is positive, and it is an opaque one. Transillumination test is negative. And coming to differential diagnosis, first one is sebaceous cyst, and next one is lipoma. Investigations include X-ray and CT scan. Treatment is excision. So as it is a 5-mark question, just what are the definitions of the types, examples of the types, if needed, clinical features, investigations, treatment, just the name of the investigations and the treatment is more than enough. And next, coming to tubular dermoid. So the word tubulo means tube. Here it refers to an ectodermal tube. So the cause for the tubular dermoid is, so consider this is a congenital ectodermal tube, and this tube after birth should get obliterated in the sense it should get wiped off, but it does not get destroyed, and it is present as it is. And obviously the ectodermal tube is lined by some cells, and imagine these are secretory cells. These are secretory cells, and these secrete some secretions. So what happens is, due to the unobliteration of this ectodermal tube, the secretions from these cells gets accumulated and forms a cyst known as tubular dermoid cyst. So you can get clear here. It arises from embryonic ectodermal tubular structures. It is due to the accumulation of the secretions of the cells lining the unobliterated portion of the congenital ectodermal duct or tube. So examples include thyroglossal cyst, ependymal cyst, post-anal dermoid cyst, urachal cyst. This is due to the persistence of thyroglossal duct, and ependymal cells is due to the sequestration of neuroectodermal cells, and post-anal dermoid is due to the persistence of post-anal gut, and urachal cyst is arised from the remnants of the urachus. The word urachus meaning is it is a tube connecting the urinary bladder and around the umbilicus. So next, coming to the implantation dermoid. This is a simple type of dermoid. It is an acquired cyst. Why it is called as acquired cyst is it is caused due to minor pricks, trauma, etc. So consider this is the surface of your heel or surface of your finger or something. When needle is pricking here, this point of epidermis or epithelium gets implanted here and forms a cyst known as implantation dermoid cyst. The epidermis here gets implanted here and forms a cyst known as implantation dermoid, and it is an acquired cyst actually, and this is formed due to minor pricks or trauma. This epidermis gets buried into the deeper subcutaneous tissue. The common site is fingers, toes, feet, as it is prone to more injuries. In case of fingers, as you can see in tailors, they get more finger pricks, and in toes and feet is common for thorn prick or something. So next one is the clinical feature. This is also painless, smooth, soft cyst, and it is also non-transilluminating. Differential diagnosis is lipoma and bursa. Complications include infection, rupture, and due to this pressure effect, it occurs in the fingers. So due to the pressure effect of this cyst, there may be digital nerve compression may occur. So pressure effect over digital nerve, and treatment is excision of this. Next one is a teratomatous dermoid. This teratomatous dermoid is a congenital cyst, and it arises from all three germinal layers, and it occurs in organs such as ovary, testis, retroperitoneum, and mediastinum. The most common one is the ovary, and it contains teeth, cartilage, hair, sebum, muscle. As it arises from all the three germinal layers, it may be benign or malignant. So this is about dermoid cyst. First we are writing what is the definition, and next is the consistency of the content, what the contents is made of, obviously what are the structures present in the dermis, and the secretions must be the contents, and next is the three types of dermoid cyst. So out of this, three are congenital and one is acquired, and next one is the sequestration dermoid. We are writing the definition of sequestration dermoid, examples of sequestration dermoid, complications, clinical features is same, painless, smooth, soft, and it PERIS test is positive, transillumination test is negative. So next one is about the investigation, treatment, differential diagnosis. Next, coming to tubular dermoid, what is tubular dermoid definition, examples of tubular dermoids, implantation dermoid, what is the cause of implantation dermoid and where is the common site, clinical features, and treatment is excision. Next one is the teratomatous dermoid. I hope you all understood about dermoid cyst. If you like this video, please like, share and subscribe and follow for more videos.